Hi guys, welcome back to my channel. In this video, I have come up with an idea of discussing real life cases of how people actually treat so that it would be helpful in our NEET PG examination to be clinically oriented. And I hope this will be useful to you. Thank you so much. Let's get started. I'll start with the positive findings of the patient and then how he was taken from that to the diagnosis and to the treatment. It will be a very short video, so don't worry. I don't want to waste any of your time, guys. A 57-year-old male came to me complaining that the patient has hoarseness of voice. So please don't compare it with me. But the patient is having hoarseness of voice. You can just see the video which is going to play on the screen, that he has that voice when he came to my OPD, and that is present with the patient since 2 months.
ఇప్పుడు తీసినప్పుడు లోపల కొంచెం రిజల్ట్ చేసినాను అది చేసే కొంచెం తేడా ఉందని చెప్పేసి ఎందుకన్నా మంచిది అని చెప్పి రేడియేషన్ పెట్టమని చెప్పారు మేడం చేయండి మేడం 30 ట్రీట్మెంట్ మేడం పోవాలని 5 చెప్పిన
So the patient has hoarseness of voice along with sore throat, and all other findings were normal in the patient. The patient do not have any signs and symptoms of upper respiratory tract infection or common cold, or the patient do not have something like GERD or dysphagia. He used over-the-counter medications for which the symptoms did not subside. A risk factor of smoking which is present since 30 years, and he has just stopped it 3 years back, and his pack years was 30. So here is how we calculate smoking pack years. You can see on the screen here. So he stopped taking it 3 years back, but the effects were still there on him. So the patient is a known diabetic and hypertensive. He has already undergone CABG surgery previously. So this was his entire history and nothing more significant in this patient. I advised him to go to the ENT physician and get his checkup done. So he went to the ENT physician. There they did an upper J endoscopy after making him use some antibiotics and medicines which was prescribed for 1 week. So he used medication for 1 week, after which he again went to the ENT physician to get his checkup done. The ENT physician advised the patient to have an upper GI endoscopy for him. So he underwent upper GI endoscopy for the same, where the upper GI endoscopy showed this particular finding which is shown on the screen here. So this is the vocal cord growth we can see on the screen, which is not something we usually see like vocal polyps or vocal nodules. You can see both images here, where vocal polyp is usually unilateral and vocal nodules are bilateral. We may suspect them in this patient because he is a conductor. He keeps on shouting at the patients, so he may have something like these two, but that particular growth is anywhere near between these two. It is something shown as in before upper GI endoscopy images, something like this. So you can see this is how the growth was. The patient also had a battery of tests like ultrasound abdomen and pelvis which showed hepatomegaly, and chest x-ray which showed post-sternotomy sutures because the patient undergone CABG previously. The growth in this patient was not at all like benign. It seems like neoplastic. So the surgeon ordered something like this, which is known as microlaryngoscopic biopsy, which is shown right in front of the screen. So the biopsy was done and the patient got confirmed that he has a squamous cell carcinoma of vocal cord. Staging of this cancer, we need a CECT scan. So this patient was underwent a CECT scan. The CT scan films were not actually given. I would have posted it also, but it was not given. So I'm just taking a screenshot from Google. You can see how it looks if vocal cords are involved in a CECT scan. The CECT report was given something like this, that an irregular growth was seen along the vocal cords on the anterior commission of the vocal cords, also involving lateral wall of hypopharynx. This is the report which was given. So the patient was staged into T2, N0 and M0 because there was no metastasis And also there are no nodal involvement, by which we can understand that most common carcinoma we can see on vocal cords is glottis. In glottic cancer, we don't see any much of lymph node involvement. Thus, here also there is no much nodal involvement, giving us with N0. So T2, N0, M0 is what is he was staged with. As we all study in staging, you can see on the screen here, T1 is less than one subside and T2 is more than one subside which is involved in the vocal cord. It is a squamous cell carcinoma of vocal cord because that is most common. Because he is diagnosed with stage 2 laryngeal cancer, both stage 1 and stage 2 are treated with radiotherapy until unless there is soft tissue involvement or any complication is there, the patient usually goes for laryngectomy. Otherwise, in stage 1 and stage 2, he is only confined to radiotherapy. And in my case also, the patient is undergoing radiotherapy. He was started on radiotherapy 3 days back. So this is how a patient with hoarseness of voice and sore throat has ended up with stage 2 vocal cord cancer, and this is why smoking is injurious to health. So if any non-medico is watching this, then please do avoid smoking. Even if you stop smoking at one point, you may be a risk factor for cancer in the future. So you are seeding your cancer for yourself. If medicos are watching this, my entire motto is to tell you that this particular follow up of a patient from his symptoms to what investigations he was went with and how he finally get diagnosed and how he was being treated now. I am not a full term ENT physician. I couldn't tell you much details about it, but whenever you are studying any laryngeal cancer or vocal cord cancer, remember that squamous cell carcinoma is the most common type and smoking is the one of the risk factor. There are so many types: glottic, subglottic and supraglottic, where glottic is the most important one. And CECT is how we stage the cancer. The complaints, usually hoarseness of voice is the earliest complaints that patient would get. That is why this patient is now in stage 2. Otherwise the patient would have been progressed to a late stage cancer, so that he could come to the OPD and get checked it done. If you are someone like me, if you are doing a job and you are studying parallelly for NEET PG, this is how your NEET PG approach should be. You are clinically oriented at the same time. Along with it, you are studying. So that now you will never forget if you are having a picture of how it goes through the OPD and how patients are doing it. Can you sense it? Can you imagine it? How beautiful it is when you are seeing what you are studying. Like you study the vocal cord staging and all, it will be very boring when you study it and you will eventually forget it. But in real life, they are actually doing this. They are staging it as it is, as we are studying. That means it is not futile, it is not waste. We are useful for that matter if we concentrate on this. I mean, if we go to our PG specialization, it will be really helpful for us. That's why we are reading this. So read in that point of view, understand how things are working. Try to make knowledge out of it while you are working at your place, so that you won't lose hopes of losing NEET PG. I think it is the best way to study for NEET PG. Thank you so much for being with me, guys. I hope this session is useful. If you want any such discussion sessions, let me know in the comment box and how this session went. Okay, thank you so much. Bye bye, guys.